Namaste, Hamish Kushrovatia. I am JV'n Dr. Meenakshi, Assistant Professor in Department of Shalakya Tantra, Faculty of Ayurvedic Science, Jayoti Vidyapeeth Women's University. आज का हमारा टॉपिक है internal hordeolum. So what is internal hordeolum? It is a suppurative inflammation of the meibomian gland associated with blockage of the duct. Here you can see the images of hordeolum, and they have differentiated the hordeolum from chalazion. Hordeolum is the infection of the glands of the eyelid, whereas chalazion is a sterile chronic inflammation that results from a blocked meibomian gland. Hordeolum is of two types, internal hordeolum and external hordeolum. In internal hordeolum, the involved gland is meibomian gland, whereas in external hordeolum or sty, the gland is gland of Zeiss or mole. And chalazion may develop from an internal hordeolum. On the right side, you can see the image of the sebaceous glands of Zeiss at the lash follicle, and and on the right side you can see the meibomian gland, and if there is infection of this gland, this will cause the internal hordeolum, whereas the infection of the gland of this is called will cause the external hordeolum. You can see the position of the two glands, and that's why they are called the internal and external hordeolum respectively in case of meibomian gland infection and the Zeiss gland infection. Then comes the etiology, the predisposing factors. They are similar to the hordeolum externum. Age, children, young adults, and in patients with eye strain due to muscle imbalance or refractive errors. Habitual rubbing of the eyes and fingering of the lids and nose, chronic blepharitis and diabetes mellitus are usually associated with the recurrent styes. Metabolic factors, chronic debility, excessive intake of carbohydrates and alcohol also acts as the predisposing factors. The causative mechanism, primary staphylococcal infection of the meibomian gland or due to secondary infection in a chalazion. It is called the infected chalazion. Clinical features, the symptoms are acute pain associated with swelling of the lid, mild watering, photophobia. Symptoms are similar to hordeolum externum, except that pain is more intense due to the swelling being embedded deeply in the dense fibrous tissue. Signs, localized firm, red tender swelling of the lid associated with marked edema. On examination, hordeolum internum can be differentiated from hordeolum externum by the fact that in it the point of maximum tenderness and swelling is away from the lid margin, and that pus usually points on the tarsal conjunctiva and not on the root of cilia. Here in the image you can see the hordeolum internal and the hordeolum external respectively. Treatment, it is similar to hordeolum externum except that when pus is formed, it should be drained by a vertical incision from the tarsal conjunctiva. Thank you. This session is powered by digital version 2.0 Jyoti Vidyapeeth Women's University. If you have any query, please write in the comment box. I will resolve it. Thank you so much.